Hello, and welcome to today's virtual program hosted by the Healthcare Council of Chicago, HC3. My name is Megan Phillip, and I am the Executive Director of HC3. We are a mission-driven platform proactively seeking uncommon alignment to improve Chicago's healthcare ecosystem. Today, I am just thrilled to be kicking off our 22 events with our inaugural event in a brand new series, The Role of Women in Healthcare. On the heels of one of healthcare's most prominent conferences, JP Morgan, we have rounded up some stellar women who are leading the charge in industry innovation. Before we dive in, I have two housekeeping announcements. This afternoon's discussion will be recorded and shared on our website, www.hc3.health, for later viewing and sharing. And as we hear from today's experts, if you have questions, please feel free to use the chat function, which will be seen directly by our moderator to do her best to address them. And it is now my absolute pleasure to invite our special guest to join us in the virtual room. So it's my distinct honor to first introduce our moderator to kick off this important series. Lori McGraw is a Senior Vice President at the American Medical Association and launched her very own podcast, aptly named Inspiring Women, where she interviews inspiring women in all stages of their careers to explore their shared professional journeys. And our panelists today will be introduced by Lori now. So Lori, I'm going to hand it right over to you.
Megan, thanks so much. And I am absolutely delighted to be moderating this panel of incredibly inspiring women. I want to sincerely thank the Healthcare Council of Chicago for sponsoring this event. It is on the tail end of the JP Morgan conference, which is the great place in healthcare where all the money flows and you get to hear all the exciting thing. And if we were all in San Francisco together, we would be with an enormous volume of very talented, wonderful people, largely men. And so what we're going to do today in this series, where we talk to incredible women who are at the intersection of innovation, technology, whether they are funders, consensus builders, policy, or actually building incredible companies. We're going to talk to them about what they're doing and their thoughts. What is the role of women in healthcare? How can we all advance our careers? And often by doing that, the reason I started the Inspiring Women podcast, it is my firm belief that women get so much value when they hear the stories from other incredible, accomplished, inspiring women like those we're going to be talking to today. So with that, on our panel today, we have Adamika Arthur. She is the founding executive director of Health Tech for Medicaid. This is an organization founded in 2018. She's an epidemiologist. She is administrator of healthcare systems, but she founded Health Tech for Medicaid, which brings together payers, providers, policymakers, and innovators to collectively advocate for health equity and improvement in the Medicaid program. If you had the opportunity to attend the H24M conference at JPM, it's exceptional. It's been 5 years running. Adamika, we're really excited to have you today. We have also Missy Krasner. Missy Krasner is the venture chair of Redesign Health, and that is an organization. They build companies, they fund them, they scale them, they get them invested, and then they make sure that they work, and they are transformational healthcare companies. And if you don't know Missy Krasner, then you have not been in healthcare technology. Missy Krasner, Google, Amazon, where she was at the head of the Alexa Health team, Box Healthcare, which she helped to bring public, and also she started off in government, actually, at the first inaugural national coordinator for HIT, part of government. And Missy, we're so excited to have you here. Missy's newly engaged, just by the way, I want to let you know that. Also, we have Kristen Valdez here, and Kristen, if you don't know Kristen, she is the founder and CEO of Be Well Connected Health. That's a company that's been around for 7 years. Kristen herself is an executive. She knows everything that there is about payers and all of the work. She's an expert in healthcare. But when her daughter had a near fatal incident, and she herself had trouble navigating the system, she took matters into her own hands. And so she created a company called Be Well Connected Health, which is a digital health connected platform, because of the experiences that she had in managing the healthcare for her daughter, Bailey. Kristen is a CEO and a founder, and of that 2.3% of dollars going into female founders, she got $32 million of it last year in her Series B raise. And Be Well is also one of the top 15 fierce health companies, so a lot of accolades there. And last but hardly least, we have Alyssa Jaffe with us. She is a partner of Seven Wire Ventures, which is a healthcare fund that's really looking to build investments of digital health companies that support informed and connected health. And if you don't know Alyssa, you probably recognize the name because she was most recently recognized by Rock Health as one of the top 50 people to know in the world of digital health. And so Adamika and Missy and Kristen and Alyssa, thank you so much for being here on this kickoff first panel for the Women in Healthcare series. Thank you for being here. Yay. Okay, let's get going. Here we go. All right. So, again, when I talk to inspiring women like all of you, accomplished, you've made it, you are making it, you are changing the healthcare ecosystem out there, being the leaders that you are. I always like to talk to inspiring women and just understand, before you were where you are now, there was a point in time where you actually started to become that leader. You had your first sort of leadership breaking moment. I'd love to hear those stories. Maybe Adamika, you could kick us off. What was yours?
Sure. So my first, I'm an epidemiologist by training. So the beginning of my career actually was a traditional public health service. I worked for the federal government, CDC, and also a couple of local public health departments, Seattle-King County Public Health Department. And I came to California to be at the Alameda County Public Health Department. And one of the things that happened to me really early on in my career is when I got to the health department, the person whose job I was supposed to replace decided not to retire. So it was a really interesting, I was super excited in the beginning because I thought, what an amazing way to be able to learn from this person who is in this role. And, it kept going, waiting for this person to, retire. And I always joke, I'm in my mid to late 40s. And I will just say that our generation, Gen X, has kind of had to wait for someone to retire or die to get a promotion. Missy did the smarter way, which is just to leave a job and actually get the next promotion. That was actually the smartest way to go about doing it. But so after about a year of this, they came back to me and they were like, I literally left the CDC to take this job. And they were like, we're going to have to find something else for you to do. And I was so confused, right? So I got put on a project to help the state of California write this 1115 waiver for Medicaid. And I was so poo-pooed by my boss. He was just like, oh yeah, whatever. Well, that ended up becoming the first state in the country to actually expand Medicaid, right? So I worked on the first 1115 waiver in the country. Now most of Medicaid work. And it actually was a pivotal moment for me personally, because I went back, we brought about $180 million to California and doing that work and expanding Medicaid to mainly men, because at the time before that, and I'm dating myself, but in 2005, before 2005, unfortunately, there were not a lot of men on the Medicaid program. It was pretty much a women and children's program just by legislation and default, depending on the state. And so that movement actually pivoted me to go from public health to hospital leadership, because we brought in so much money and we're going mainly to the public hospital system. And I really credit just all the no's that I was told early in my career, and all of the things that seemed like huge roadblocks and challenges ended up becoming so fundamental to who I am, as a person, as a leader, as an individual. And it really harkens the work and the vision that I get to do every day today.
So it sounds like also just being pulled into that first leadership position, which ended up being one of those big breaks along the way. Missy, how about you? And so, in terms of like, when did it all start? When did Missy Krasner start to become Missy Krasner?
Oh boy, it's such an interesting question. And me, I just love the whole like waiting to get promoted and like figuring out how to do that. It's a very interesting topic, I think, in particular for women executives in healthcare. So I think we'll loop back to that. For me, I think there's a distinctive difference, and I tell this story all the time. For me, there was a difference between having a job and having a career. And I really distinctively remember it was at the point I had started, I had started a company with Dr. David Brailer that did go public. And I was lucky enough to come in very early and kind of ride through that. This was enterprise software selling into hospitals. But it wasn't until I went with him to government to serve in the first office of the National Coordinator for Health IT, where three things happened that put me into a career. One, I was incredibly stretched and trying something that I had never tried before. The kind of learning curve was so like large that I really felt like I had to throw everything in. It wasn't just a job. I think the second thing that was really interesting is that I had influence. I had a scope of influence that was phenomenally interesting. And I think the third thing that I noticed was that I was on the forefront of creating legislation or doing things that would have scope and scale. And so for me, at that particular point, after doing serving in the government, that's when Google came next. After that term, people were very interested in the fact that I had been at the forefront of business, policy, and government. And so just the knowledge base and the experience, it's always a missing gap. So I sort of then punched into the next part of my career, which was being really, really heavily recruited and sought after by many of the large technology companies, including IBM, Salesforce, Google. I had sort of my pick coming out of that job. So that was my pivotal point.
Well, it's also
He's a mentor of mine.
Yeah, and we all have those early mentors and people who help. But one thing that's interesting, again, I speak to a lot of women, recognizing that point at which you actually had influence and power, and then being able to do something with it is just kind of interesting. Alyssa, how about you?
Sure. What amazing stories. And I love hearing everybody's hero's journey and where we get to where we are. I will tell you, I was not a little girl growing up dreaming of being a venture capitalist. I'm actually one of 5 kids, and frankly, my path, my parents went Big Ten, my family went Big Ten. That was sort of the path. And it took me a long time. I started my career as an operator. I worked for a very long time for the advisory board company, who many of you may know. I had a wonderful experience and career there that really helped shape a lot of how, even today, I think about go-to-market strategies and some of the discipline that we implemented. As young as 23, I was presenting to full executive teams and just continued to grow from there. And it wasn't really until business school that I really understood that there was a much bigger world out there. And, I think one thing I hope to do with many women today is introduce them to career paths and encourage them on different career paths that may seem atypical. And just like which is seeming to be a theme of many of the women on this panel, most of whom I said, once I thought I was interested in venture capital, most of the people that I shared that with said to me that wasn't going to be a successful career path for me. And I had a lot of pushback from, some people that I consider mentors, a lot of people who were just, giving feedback more generally. The little did they know, one of the things that drives me the most is if you tell me I can't do something, then I'm definitely going to do it. So it became a true fire. And a lot of folks say, well, what was your plan B if it didn't work out? And I said, I didn't have one. It doesn't work that way in my mind. But when I say I'm going to set myself and do something, it's just a matter of time. So ultimately, I think we've all had really interesting hero's journeys. We've all had supporters in our corner, and we've had a lot of naysayers as well. And I hope that as we continue to build and to grow, and for the next generation of all leaders, but particularly female leaders, I try and tell everybody, like, my job is not rocket science, right? It's about supply and demand, and there's a longevity to this job that requires a lot of discipline. But at the end of the day, if that's where somebody's passion is, what I'll do is give you the advice and the recipe for what I think makes success. But the beauty of this industry is all walks of life can be successful. You look at all of the top, venture capitalists and entrepreneurs, they come from all different places, right? They think about all different types of things, and that should be encouraging, that it shouldn't just be a cookie cutter model the way that it was thought of in the past.
Yeah, and I also really appreciate, Alyssa, and what you're saying. Just, I think most successful women feel a sense of responsibility for others and to help other women in particular, move forward up and broader. And that really came through in some of your comments. Kristen, how about for you? And I told a little bit about your personal story of how you found in Be Well, but I don't know that was your first path to leadership. You've had an amazing, amazing history.
Yeah, I tell people a lot of times I feel like I fell up in my career almost accidentally. Right out of college, I was recruited to work at T. Rowe Price, and so really financial services, not even healthcare. And when I went in, there was a reorganization, and the entire department around me left the organization. And I ended up reporting in my first week in my first job to the executive team at T. Rowe Price. I was considered essential personnel, helped to create all the board of directors materials. And so my first mentors were the most senior leaders at a very, national, very large financial services firm. And I don't think I actually appreciated at the time what that meant to me and to my career, but the lessons that they put in me during that time, I still use today. But I think perhaps the most pivotal moment was when I went to work for a company called XL Health, which was originally founded as a disease management organization. And I was brought in to do all of the reporting and analytics. I had just come out of CMS doing the actual integration of Medicare Part A and Part B data and the first Medicare and Medicaid matching data. So I learned a lot fundamentally about healthcare policy and healthcare data and how it worked. But we pivoted at XL Health to becoming one of the country's first private Medicare Advantage plans. And I remember sitting in my office one night, and it was like 7:00, and I was working on, some projects, and this new CEO, turnaround CEO with massive success, came into my office, and he goes, "I hear you know something about healthcare and payers and reimbursement." He goes, can you come here for a minute? And I said, sure. And I remember walking into a boardroom full of all men, squished into this tiny room. And he was like, "Can you tell me what I'm looking at?" And what they were looking at was actually a claim record and an adjudicated claim record. And I explained to them that what they were showing me wasn't actually possible unless they were paying every claim twice, which of course couldn't be. And I said, "You have a reporting error," right? And so I'm looking at this, and he comes into my office, he follows me back, and he says, "You work for me." He goes, "We're going to build a health plan." And I said, okay. And so I had the unique opportunity of building a health plan from the ground up. Missy, you talked about stretch jobs. I was way out of my league. I had to figure out how to build in and internalize an entire claims processing team, customer service team, appeals team, regulatory team. And I had to read all the Medicare regulations to figure out, what is an MLR? How do you manage one? How does people get paid? What are the 17, payment mechanisms for risk adjustment? So I had to learn it all from the ground up and build those teams and move on and build other teams. And we just happened to put a really awesome team around us because of that mentorship. And that's why when my daughter got sick, at the time we had exited to United Healthcare, we had a very solid exit, and I stayed on for 3 years there. But when my daughter got sick, I was given all kinds of great jobs by Optum and UHG and UHC. And I just felt like I couldn't get anyone to pay attention to the consumer side of things and what I felt was missing. And I just said, well, I can always get another job. I feel like I know enough in healthcare at this point that I could get that job. And I feel compelled that I have to at least try, because I think I'll regret if I don't. And so I left and said, look, I'm going to give myself a year to figure out if I can make this happen. And we're 7 years in and still going. So really excited about that, but certainly learned a lot. But I think that's where my pivotal moment was.
7 years and going very, very strong, I think, by any evaluation of things. Let's talk a little bit about JP Morgan. I mean, this is the big kickoff conference of the year. It might be another year of virtual JP Morgan, but that doesn't mean the level of innovation and funding and deals flowing has died down. You know, we have $29 billion, according to Rock Health, that was invested in digital health alone in the United States in 2021. That was up from just over 20 billion, which was already an astounding figure in 2020, and we're in a pandemic. What are folks seeing? What's exciting, and where are the opportunities for women? Maybe Missy, we could start with you.
Get off mute here. I think it's an unparalleled time in company creation, funding, and there's just such a concentrated M&A landscape right now as well. It's very exciting. I feel for those of us that have been in digital health for 3+ decades. I've always felt like we've been a parentheses, and this is the first time that I think everybody is sort of like running to our industry as a subsegment. So I'm thrilled. I think as far as what this means for women, I think there's so much more openness to first-time founders and also sort of veteran founders who have had exits but want to sort of come back and maybe do something that is a little bit more niche or something that's been a long time passion project. And I think that because there's more funds, and our Series A's are now really like B's, just as far as a fund size. What I'm also seeing is that there is this ethos now, and thank goodness for diversification in healthcare. The healthcare equities is up. It's just a phenomenal time for people that have normally had a really hard time taking on risk. To start thinking about being received more with a lot more support. So for example, at Redesign, one of the things that I think I've really seen is we have 30 companies, we have a handful of very, very accomplished female CEOs in some of our companies. I have the privilege of working with Jaja Yi at Springtide, which is our autism clinics. Isabel Kenyon's working at Calibrate, which I'm sure many of you have seen that company is doing great things in weight loss. Both Jaja and Isabel are first-time CEOs. Jaja was at Oscar Health and One Medical prior doing, VP ops roles. And this is a time for her to step in and drive her own company. And the same thing with Isabel, who's leading a fantastic company that just raised a very large Series B. She was a, VP of Biz Dev at Capsule. So the point is if you are looking to jump into being an executive leader or starting a digital health company and you are a first-time founder, it is the time to go. The risk profile has gone down. And if you're trying to have a balance and juggle a family at the same time, or elder care caregiving, there is an environment now that is inviting you to take your own personal experiences of being a family manager and a consumer of healthcare in the home and translate that into your everyday work experience and your leadership insights. I think that has never been integrated before. We are hungry for that, and it is happening now. So okay. I'm super excited.
Okay, so first-time founders, and so far for women, the numbers don't back you up. So I'm going to hope that you are absolutely correct. Adamika, what are you seeing? You just had a conference at JP Morgan. Where's the innovation coming from?
Yeah, I'm gonna talk about first-time founders too, but I want to say this is the first time, and I'm interested in getting Alyssa's thoughts on this too, where Medicaid actually was featured at JP Morgan, aside from those of us who created Medicaid being featured at JP Morgan. So 5 years ago, Health Tech for Medicaid started this movement, really in a community space across the street from any of the hotels that have $18 iced teas. To really make sure that we could come together and start to convene to talk about what is the largest insurance company or the largest insured population in this country, what is a fifth of Americans, and what really represents a unique set of diversity from cradle to grave, right? It is a program that literally from birth to death, it's 53% of the births in this country, and it pays for over 70% of the palliative care in this country. So it is truly, when people used to say like Medicare for all, we already have that program, it's Medicaid. But so I was thrilled to see like CMS leadership, Chiquita Lachar Brooks, their online. I do think that there were barriers to entry previously, because I think for a lot of folks, having it be digital allowed people to chime in for an hour and then leave. I think there's good and bad to that. But you know, there was kind of, I just felt like as a hospital administrator for many years, I would go to JP Morgan running hospitals, public hospitals, and I always would go in with my head held down because I had negative EBITDA and I really cared about the community. And no, really, and it was not my favorite conference by any means. Nobody looked like me. There was very few women, but there certainly was like, you know, raisins in a mayonnaise jar, like trying to find anybody who's a person of color was the easiest thing to do, was to find another person who had any melanin. So, you know, I missed that it wasn't in San Francisco. I missed that it wasn't in person, because I do think that the transactional nature of healthcare really is done in person. We are relationship people, and that's where women win. Women win because we know how to create relationships with others. We just have to be given an opportunity. And oftentimes we have to be given an opportunity like 6 or 7 times, right? Like, it's unfortunately, you got to go in there with your game all together. Missy, I do want to talk a little about underrepresented founders and founders in general, women and female founders, and non-binary founders. You know, there has been a real movement talking about supporting founders, but I, deep in the ecosystem, really don't see the level of support. And I'm super interested in what Kristen has to say here. You know, I have always worked with underrepresented founders because they pretty much are the only people we got in Medicaid related, you know, digital health product delivery.
Let's hold that great thing, because I think the, you know, I want to, as well, just like you, Adamika, like us, so like what is going on? So we've got founders. It's a great time for founders, and you're saying it is a great time for innovation in Medicaid. I do also want to talk about where is the money going. Maybe Kristen, what are your thoughts? Just what are you seeing that's fun and exciting from your viewpoint? By the way, before we get on this call, Kristen could barely look up from her computer. She said she's so busy. She's almost on a 24/7 cycle these days with work.
Yeah, no, I mean, certainly it's a great time in healthcare. I will say that I definitely did not feel the support, and that it was a great time to be a first-time founder or a female going through my entire journey. I feel like it was hard. And I do feel like the questions and the diligence that we are put through is very different than what men go through. And we've done studies of this. I'm a member of the Springboard community, and we've actually started to document and create data around what are the kinds of questions and what are the kinds of diligence and what is the standard that you're being held to compared to male counterparts. And we have a lot of men who can also contribute their data. And you know, it's interesting because I think the big difference that we found, and I have experienced this personally, is that women are typically asked to defend 100% downside risk. What is going to happen? How are you going to be conservative? How are you going to manage all of the things that could happen? I mean, to think, I've been asked, what happens if this regulation changes, you know, and I'm like, that's a years-long process. We have time to adapt to that, you know? And I mean, and quite frankly, I do think that there is still a lot of bias in the fundraising space. I can't count the number of times I've been asked what my husband does and whether or not he is offended by the work that I do and how he supports me. And I'm not saying 1, 2, or 3 times. It's a lot of times that I get asked those things. And I don't think that male founders are asked the same thing. So capital raise has, in my opinion, been very difficult. And I don't know that Be Well would exist if it weren't for the fact that we had a $2.4 billion exit behind me in my last role. I really think that it is hard. And I mentor and I'm on the board of many other female founded companies at this point in the networks, because I think, you know, to Adamika's point, network is everything. And they have just as many challenges. But when men get asked for diligence and in conversations, it's all about the potential upside and where they think that it's going. And I think that there's an inherent bias in how difficult it is to get funding, because it's much easier to find the red flags and say no to a female with that bias in place than it is for men. And so I will say it has not been easy for me.
So in terms of that, and we're sort of getting into some of that like practical advice, maybe Kristen, just a little bit more from you, because while those obstacles are there, you also had the $32 million Series B just last year. So what's your practical tip in there? Knowing those obstacles are real in terms of addressing them, and how do you hit them, whether it's in a capital raise or just how you show up in the venture world. And then Alyssa, I'll turn to you for just sort of like, how you approach it, and if you look at things differently from your chair as a funder based on who's sitting across the table pitching to you. But Kristen, you go ahead.
The quick tips that I would have is, one, find a female in your industry that went right before you. Know who's actively investing, know where the bias exists, understand what has to be in your data room that looks different than what you might find online or in a best practice VC. And the strategy for us is that we found customers, and our customers became our investors until we got to a point where it was appropriate to bring in financial and VC, because our customers could stand behind the data, our service, our performance, and that our system does exactly what it says that it does. And so it became much easier as we got later and into bigger rounds to bring in more financial VCs, and we were able to get past that bias. And that worked for us. I'm not going to say that that's going to work for everyone, but having customers is key no matter what if you're growing a startup. So having that grown revenue and having those customers stand behind you and finding the ones that could actually fund you is how we were successful.
So building some extra steps, that sounds great. So maybe Alyssa, your perspective as a funder, and maybe even bringing in Adamika's point about not just women, but also women of color. What are the perspectives? Do you look at things differently depending on who's pitching to you?
So first of all, thank you to all of the panelists for just sharing your perspectives and your stories. And it's just, I think we have a lot of work to do, that's for sure. And I guess I'll give my perspective first on the macro environment, maybe in combination to both Missy and Adamika, and then maybe more specifically on funding and how to think about pitching as it relates to some of the astute comments that Kristen made and some of the things that she and her team have gone through. Ultimately, my perspective, look, capital it's been a crazy market in digital health. We are now on pace to surpass 40 billion in 22, maybe even up to 50. We'll see how that goes. But ultimately, to Adamika's comment about the encouragement that now we're starting to see real investment in underserved populations, particularly in Medicaid. I mean, a number of our companies sell into Medicaid. 4 in 10 births are on Medicaid. Like it's not like this is a small part of the population here. And historically, the venture cycles haven't been conducive to what it means to really build a transformative healthcare business, right? Venture cycles are raise money every 18 months and get out of this thing in 5 to 7 years. Well, it takes 2 years to sell a managed Medicaid plan. So that doesn't really match in the same way. And now we're starting to see these larger financing rounds where the one, pretty inspiring component of that is people can swing for the fences, that entrepreneurs now can build things that are not just incremental, but can actually build companies that are exponential. And that's what's been pretty exciting. As it relates to women's health, again, you mentioned, Lori, some of the statistics. I won't go through that, but ultimately, as we think about the primary decision makers, we think about the number of healthcare, a women's issue is not just a women's issue, right? It's really, and by the way, women's health is more than just pregnancy. And there's some amazing solutions out there focused on pregnancy, but it's also, fertility and postpartum all the way up to menopause. And by the way, it's Gen Z women's health. It's focused on early stages. How do you get introduced to the US healthcare system as a woman? Many of the people on this line, I imagine, are thinking about their own experiences as teens in college, student healthcare centers. I mean, it's really abysmal. And all of that has to change. And frankly, there's many companies that are now being set up to help transform this, and particularly to support also the growing mental health crisis in this company that is disproportionately affecting women. So,
but to be fair, many of those are men who are the CEOs of those companies.
Yeah, I would say I'm a big believer in what I'll call founder market fit. And so for me, regardless of who you are, you have to believe in it. There has to be a reason why you are the one to do this, because frankly, healthcare is pretty easy to pick a problem. There's plenty of problems for lifetimes here. So why is it you, right? Why do you care about this? And I have men and women in my portfolio, a business called No CD, severe mental illness, supporting obsessive compulsive disorder. Stephen Smith has OCD, has lived with it his whole life, knows what the debilitating nature of the condition is. Brightline, Naomi Allen, many of the women on this call know Naomi. She's fantastic. She is focused on building a business to support pediatric behavioral health because of her own experience with her children as a mother. So it's really, for me, like, I don't want to pigeonhole and say you have to do this, you have to do that, but you got to know what problem you're solving. I've been pitched plenty of businesses about talking about postpartum, and they're talking to me about breastfeeding, and I'm like, you've never had a baby. I can hear that, and that's hard. Like, it's fine, but at the end of the day, like, how are you selling to your customers about that? Like, how are you connecting with your end consumer?
Yeah.
If it's not you, who's on your team to do that?
I'm wondering, Alyssa, just Kristen, I really appreciate your personal experience of sort of the ways in which you've seen bias around investors, fundraising, and questions you get asked. I did a short stint in traditional venture. I was at Morgan Taylor Ventures, which is now Canvas Ventures. We did Practice Fusion, Doximity, Health Loop, Stephanie Telanius's company, Vita Health, a couple others while I was there. And I think Leah at Wildflower, who is a fantastic executive, we all know. I think she probably said, sort of epitomizes that. She would literally live her brand, go in, pitch for her Series A or B, and actually, was pregnant and living a family health and pregnancy brand. And I have to say that it is real. I experienced it all through my career. You do get asked different questions. I think one of the things that I think looks different today is we're sort of in it's a buyer's market. There's so much innovation right now, and investors want so badly to write checks that I think it's a forcing function to start sort of really opening up and changing that behavior. I think that we're finally coming to a time now. I will say private equity and growth equity, I think, is still different. There's still a culture of ex-bankers and people that are really sort of bottom line and not really looking at product market fit in the early days, and sort of like the visionary leader who has the right to be the ambassador to the brand, or the experience or the knowledge. So I do think that at least what I've seen, we've got over 30 companies that are fundraising at any given time, and we've got all kinds of people. We've got diverse leaders in our portfolio that are fundraising and are not getting those questions as much. But what I will say is that any time I'm working with a CEO, or I'm coaching someone, or I myself in my own career are thinking about how effective of a leader I can be, I always talk to people, regardless of their gender. What is your risk tolerance right now, and what is your risk profile? And to me, that means, what is your partner or your husband or your kids or your dog doing? Like, what is your setup so that you can be your highest self in this business? And I need to know that if I'm going to be on your board, or if I'm going to be a coach to you, because like the new realm that we're in right now is that you have to bring your whole integrated self to work. And COVID has forced that and exposed that, because look at us, we're all talking to each other from our offices and our rooms. It's so much more intimate now, right? And that's what I love. So I am hopeful that we are in a sea change. But Adamika, I would say that there are a few potholes of investors that are exclusively investing in diversity and or women. We're starting to see a little bit of that, but it is nowhere where it needs to be.
So there's a lot of advice in here, which is good. And I think that, in terms of, Kristen, what you're saying, just that, there are real issues and there are systemic issues, and those are also sort of some reality, and hopefully that reality is changing. It's my view for women to make progress, and we've got some points of optimism here. Buyer's market, great time for founders. Women are inherently relationship builders. And if you're going to bring your whole self to the job, to the passionate place of being, whether it's a founder or a leader, that can be an asset to you perhaps in this time. I'm going to put optimism on this a bit, but I want to go to some practical things. So in terms of making those things happen, you all told stories of your own personal stories, whether you fell up into leadership, someone gave you the opportunity, I suddenly realized I had influence. Everybody's hero's journey, leadership journey started in different places. I think there's sort of two key areas that are women often talk about, whether it's their networks or whether it's their mentors and supporters. So I want to just go into a practical space for a minute. And so maybe Alyssa and Kristen, maybe could you just talk about networks? You know, first of all, like, how do you build a network? How do you think about your network? Did you think about your network? You certainly have them now. Why are they important? Maybe Kristen, you could start on that topic.
Yeah, I mean, I will tell you, when I started this business, I was an introvert in a big way. I did not have a network. It did not exist. I didn't have confidence that I could reach out and communicate with someone or have small talk. But your network is absolutely everything. And I wish I had been taught that earlier in my career. And I also wish that I had been given the little tip that I now give to everyone else, which is if you start a founder's journey, you need a spreadsheet or a CRM that literally tracks every human that you meet, where you met them, what you know about them. Because guess what? By the next time you see them, they're going to be at a different company with a different title. They might be married. You might not remember that you met them. I'm bad with names, but those people and their history can help introduce you to other people that you're trying to get to. So there's really great organizations out there that you can join, especially for women, like Springboard, that have massive networks already, or, you know, even with Health Tech for Medicaid. I mean, Anamika, how many people were you able to introduce me to through the other organizations that were there? It's now much, much easier for us to reach out. And I think in this time of COVID, I've learned another really key lesson, which is in the great resignation and in all the like kind of job shifts and things like that, being able to reach out, even as a founder, to people who you think this would be an ideal person to hire, and just reaching out directly and spending time on LinkedIn, like, hey, wow, your background is really impressive. You look like you could, you know, you'd be really a good fit for BeWell. You may not be looking, but I'd really just love to make the connection. And if that person's not looking now, they may come around in 6 months and say, oh, you know what, I'm looking and I really would like to talk to you. It meant a lot that you reached out. And we're getting some really awesome hires right now. And we're growing like crazy, but I feel like we're really leveling up in terms of being able to bring a lot of experience through those networks. So networks can help you not just with investing, but also even in building your business, and especially getting connected to other people that you may not know and leveraging those tools that are out there to do that.
Yeah, those purposeful connections make a lot of sense. And there's a question in the chat for the retiring dentist in the audience of how to go about doing the networking to break in. And there's also studies, you know, in terms of building networks, women and men, just generally speaking, network differently. Sometimes women feel that it's a moral dilemma to ask someone to do a favor for them, whereas, you know, that's just networking. Alyssa, what are your thoughts on that?
Sure. I think my first piece of guidance to this audience is, I will not tell my young children this, but as you get older, there are no such thing as strangers. And so the people that you meet in life, you know, think about the interactions that you have. And to Kristen's point, invest in the longevity of those relationships, because many of colleagues I worked with decades ago and friends from growing up, from college, from business school, from the advisory board, right? They pop up in super interesting ways. A lot of them have ended up at our companies because of it. There are folks that I met at a conference and on both sides. One is I got in touch with them, built a strong relationship, and it was amazing. Sometimes on the other side, it was, I totally dropped the ball. I met them once and told myself, this person's awesome. And then years went by and that person went and did great things. And now the relationship, it's not that it's over. It's not that it can't restart, but it's not as organic as it could have been. And so there's a lot of ways to do it. You know, there's, to Kristen's point, there's a lot of operational ways in managing a personal CRM, you know, sending out quarterly updates, whether it's on behalf of your organization or yourself. Building your brand, building your leadership brand, what that actually means, whether it's content related, social media related, in the network and doing things like this. All of us are here today because we've really invested in the community that we care about. So I think there's the best thing about network is it has to feel organic and real to you. At the end of the day, people want doing business with people that they believe in and people that they feel are real, genuine people. Be yourself. That's one of the best things about Zoom, is that like you see my pictures in the background and you can ask about it. Or we don't start calls and say, hi, how are you? Good. How are you? Thanks. Doing well. It's like, oh, my kids had COVID. It was crazy. And it sees the opportunity to be a real person and build from there, because I think at the end of the day, that's what becomes most important.
I think we all have learned about a little bit more about being a little bit more ourselves. And you all saw me moving around as the sun is moving here in Montana, where I am. Missy, what were you going to say?
I was just going to add that one of the things, so I've thought long and hard about culling the network and staying connected to people, and especially in this sort of digital time. I actually set aside 3 to 4 half-an-hour slots a week to network and mentor. And generally it's for people that are newer in my network or people that my trusted network refer in. And I think that kind of sort of velocity, so it aggregates week after week after week. And I find that, I continue to grow because, and I also spend a lot of time trying to actually go back to people that I've met. So for instance, I did venture for a while, then I stepped out and did Box and Amazon. And so for me, it was really important to keep a lot of my venture contacts up. And I was able to do that in big tech by giving the big tech point of view. So I think it's really important to like cull the network, particularly if you've been in this industry for a long time. The last thing that I just wanted to bring up, and I certainly don't want to go off topic, but I think network, relationship management. I loved the, women win with relationships comment. I think that's so insightful and so well said. I think that the one area that I think I personally, and also I see a lot of our founders get a lot of help around is negotiating. This is a place where I think specifically women founders second guess. And I think that really getting a lot of support on, it doesn't matter if you're a founder and you're trying to actually close a round in your negotiating terms, or if you're in a large, healthcare incumbent brand, whether it's a payer or a provider, and you're trying to negotiate a promotion or, even an M&A deal. It's very interesting. And I think, Kristen, you probably have so much to say about this, right? Because you can come in and be a hard ass, right? And be really, really sort of clear about what it is that you want, what your worth is, and what you're doing. But because you're a woman, that could come off a certain way, right? Very much a double standard when men are negotiating at that level. And I find that is still a very it's the art of influence, right? It's authenticity. It's really figuring out how to be influential, how to present, and how to really lean in on what it is that you want. So that is the piece sort of at this point in my career that I'm like the most interested in. And many of my mentors have accomplished that sort of level of finesse in their negotiations. And those are the people that I call upon, even in my deal making, which, when you're building companies, you're in all the time.
Negotiation, I would say, again, having, speaking to a lot of women about sort of like, what are they seeking as they look to evolve their leadership careers. The negotiation is probably the top thing of where there's not enough confidence. And this is not imposter syndrome. This is none of that. This is just, I want to become more skilled at doing this in the right way for purpose. So maybe, Adamika, maybe you could pick up on that point, what's your advice there? How did you get good at it? And I'm going to assume that you're fantastic at it.
Well, before I get to negotiation, I'm going to just say that there's also in networking, it's really important to remember what grounds you, right? Because I do believe, and I'm an extrovert, most people who know me, well, I'm attached and love people. So I'm a very unusual epidemiologist, but I never lose sight of my why. And it was really easy when I worked in a hospital. I could get on an elevator and I could hear stories and I could hear about how the food was terrible or the parking attendant was rude or the doctor did something, right? And it made me being an operator super actionable. And I found when I started Health Tech for Medicaid, I missed my community aspect. I missed the thing, because when you're a hospital leader, you're building stuff and planning stuff that's like 10 to 15 years down the road, right? But my why was always really close. So I found that it's really important to keep your why pretty close. It's just been challenging during COVID, I will say. But for most entrepreneurs, like I got to meet lots of people, entrepreneurs, investors. When I go to cities, I often, like, instead of going to coffee or to cocktails with folks, because you only can have so many coffees and cocktails, and I'm from Seattle, so I have a lot of coffee. I started volunteering with people and then inviting people to come with me. And that's how I met a lot of people. It's like, oh, I'm going to do a shift at the Salvation Army. Like, come with me. When you do work with people, like your investment in their, like who they are as a founder and learning, just spending an hour with them that's not at a bar has been transformational for how Health Tech for Medicaid. Like I feel like literally have family members. I have folks call me for all sorts of stuff, but I think it's like that intentionality around really wanting to get to know somebody on a level that's not only transactional. So I'm just going to throw that in there. I also think that Alyssa brought up something earlier, and she alluded to mental health. And I think the other thing is we have to be really clear about what we need. Like for me, that is, I need a therapist and I need a personal trainer. And those are the things that I need to actually show up okay. I need to be able to go outside sometime in the day and be outside. And so I do think that those things, like your why, understanding the ingredients that you need to show up as your authentic and full self every day. It doesn't matter if you are on a red-eye flight, you have to, like the things that you need are really important. And then I'll run to negotiation. Negotiation is challenging, and it's certainly challenging for women of color. I'm just going to be straight up real with it. Like I have to really read a room in 1,000 different directions to figure out how I can show up. And certainly if I could show up as my authentic self, I have to sometimes name drop all the people that I know, or sometimes really lean on, degrees. And if you know me well, I don't ever tell you my degrees. Like you won't see a business card that has 9 million letters. So I find negotiating challenging because we live in a society where folks judge you before you even show up at the door. So I use, all the negotiating skills everybody else uses, but I also use my network to help me negotiate better. So I have people like vouch for me, right? Like I have people, and many of you, like a couple of you on here, like have gotten these, like, hey, such and such called me. Can you tell them like I'm for real, right? Like, or, like so-and-so thinks that I'm a fraud. Can you help out with this? And I think having some of that confirmation bias move down a bit is super helpful from a negotiation perspective. I also really believe strongly, and I loved Missy's comment around mentoring others. I have mentored from my very youth. I grew up in a Black church, and it was like either found something to do or found somebody to help. And that was just it, right? And so I always did both, found something to do and found something to help. That's when folks probably knew I was an overachiever. But so I've been mentoring since I was a kid, right? You can always find somebody to help. And I think that piece around being unapologetic about being a person who will open doors, Kristen will tell you, Alyssa will tell you, if you're in my network, I will connect you to other people. Whether you take the response and call and move with that. But I believe that it is my ethos as someone on this earth to help connect people together, be a connector. And so if I can do anything, I just want to be an impact, right? So I always say I'm a designer for impact. And so I don't know if that was the best negotiating advice, but it's what works for me, or what has worked for me. And I constantly try to life hack it, so.
There's a lot in there. I mean, just the idea of sort of, your networking and building relationships, and you've got some volunteers here who are ready to volunteer with Adamika. So that's like, ready to go. I'll just throw out to this audience that, one of the best books on this that I've read in a long time is Stacey Vanek Smith's Machiavelli for Women, and that came out last year. I did a podcast interview with her. She's the NPR reporter for Planet Money, and just an incredibly strong, powerful book. Kristen, maybe we'll just get your negotiation tips, and then I'll just close out getting best advice from every one of the amazing women that we're talking to today before we close out today. But Kristen, negotiation advice.
Yeah, I think women and men negotiate differently. And I think given some of the bias from a negotiation perspective, one of the best things that you can do is do your homework. you really need to know what you're up against and what your worth is, but you need to be able to prove it in a way that someone can't walk you down because it's your opinion. So we do a lot of research around, exits, people in our space, valuations, what they raised at, how they grew, and we are able to draw some comparisons so that when we're negotiating, whether, a term sheet, right, or we're negotiating a deal because we're an enterprise software, with a health system, we can say, look, here's what you're paying for and what you're getting. And by the way, you have to buy consultants and other support, and you're getting nickel and dimed here, there, and everywhere with these other types of relationships. Here's how simple we are, and here's why, and why you're getting the best value for your buck. So with me, I always like to negotiate based on data and facts. And I think that if you can back that up, it's really hard for someone to go, yeah, no, I don't agree with you, or you're not worth that, or, so I just feel like, again, just like in the data rooms, to get away from that bias, preparation is everything. And it's a tip that I would just give to women. But I do agree with Missy and Alyssa and Adamika. It is not the same today as it was when I was raising, angel and family and friends and, bridge rounds back, 7 years ago. It is so much more conducive both to women, to first-time founders, and the excitement, quite frankly, in digital health. So I think now is a much better time. I think if we had started Be Well now as compared to 7 years ago, one, we wouldn't have been too early. We'd have a lot more competitors. But I think the funding and the move, to grow faster would have been better. So I think timing still continues to be everything. But in negotiation, know your value, know your worth, and be able to back it up.
Yeah, I think that's really sound advice, and it obviously works. We're running on the edge of time here, so this has been just a fantastic conversation. We've heard so much great wisdom and advice from this cast of incredibly inspiring women at the intersection: innovation, digital health, technology, making it happen in healthcare. In your 30-second best advice for women who, like you, are trying to make it in this space, what is it? Adamika, let's start with you.
I would say continue to encourage and support other women.
Excellent advice. Alyssa?
Do something you love and that you care about and that you want to spend every waking minute thinking about, because that it becomes all consuming, and it's really hard to build companies. And so I think someone said today, there's a job and a career, and as you want to build a career to do that, you really should love what you do.
Yeah, you really should. Kristen, your best advice, and you've already given us a lot of great advice.
I was going to say same thing as Alyssa: be unapologetic about your passion and make sure that you're passionate about what you're doing, because one, it shows. People believe in it when they know you believe in it, and it can be really infectious to get behind, but it's also something that you could be doing for a lot longer than you expect. So make sure it's not something that you're going to tire of.
Fantastic. And Missy, close us out. Your best advice.
Yeah, my best advice is it took me years to get to this point where I didn't feel divided between the home and my personal life and my career. And I think you get to a point where if you love what you do, you bring your whole integrated self to work, and the people in your network become both personal and professional supporters. So that has been a big find for me in my 50s.
Yeah, well, listen, again, I just want to say, a big thank you to this panel. I mean, you are all accomplished, intelligent, inspiring, making it, and changing the face of healthcare for the better. And so I really appreciate you being here on this first of the Women in Innovation and Leadership in Healthcare. I really want to again thank the Healthcare Council of Chicago for sponsoring this series. And Megan, I'll turn it back to you to close this out. Thank you so much.
Wow, thank you so much, Lori, for leading today's conversation. And to Adamika, Alyssa, Missy, and Kristen, thank you all so much for your time and your expertise. This will not be the last time you hear from me or the Healthcare Council of Chicago, because I take it to heart everything you said about our network being one now. For everyone else on the line, we have more events in this series. This is just the tip of the iceberg, and we have so many other fantastic women to share their experiences and especially influence in healthcare. So I dropped a link in the chat that has our upcoming events, that has those. It does not include our amazing International Women's Day forum that will be happening hopefully in person. I'm not saying hopefully, I'm just saying it's going to happen in person in March. And that will be up on our events page as well soon. So stay tuned there at hc3.health/events. And for anything else you need from the council, you can go there for other updates. But thank you all so much for joining us this afternoon. I know everyone is super busy, but wishing you to stay healthy, stay well, and have a great rest of the evening. Thank you very much.